The most common mood disorder in United States is depression. About 10% of the adult population is struggling with depression. Understanding the difference between having depression and simply feeling down is important. Unlike sadness, which tends to disappear fairly quickly as your circumstances change, clinical depression is a medical condition that requires treatment. Everyone experiences depression differently. What's important is to know that you're not alone and that there are things you can do to help yourself. In this video, we'll discuss what depression is, its symptoms, causes, how your environment can affect it, and possible treatments for it. When you think of depression, what probably comes to mind are images of sad, lonely people who appear as if they have the weight of the world on their shoulders. While this is one type of depression, and the one most commonly associated with it, there are actually many different kinds. So, what is depression? Depression, also called major depressive disorder or clinical depression, is a common but serious mood disorder. It causes severe symptoms that interfere with how you feel, think, and handle daily activities like sleeping, eating, and working. In order to be diagnosed, the symptoms must be present for at least 2 weeks. When people are depressed, they experience a range of negative emotions and behaviors, including sadness, loss of interest in life, anxiety, and difficulty managing stress. Depression can make you feel hopeless, helpless, and even suicidal. It can also affect your physical health and functioning, leading to issues like sleeping problems, weight gain, and low energy. Depression is a common and serious medical illness that affects all ages, genders, and ethnicities, including children and teens. According to statistics, about 1 in 5 people will experience a depressive episode in their lifetime. Types of depression. Major depression. Major depression is defined as having depression symptoms or feelings of sadness for at least 2 weeks, as well as other symptoms like change in appetite, difficulty sleeping, and change in energy levels. Persistent depressive disorder, also known as dysthymia, which frequently includes less severe depression, symptoms that last much longer, typically for at least 2 years. Bipolar disorder, also known as manic depressive disorder, people with this type of depression experience extreme mood swings and feel sad or hopeless combined with a very low activity level. Seasonal affective disorder, also known as SAD, is triggered by the seasonal reduction in sunlight, typically occurring in the fall and winter. However, it usually resolves once spring or summer arrives. Postpartum depression. This type of depression is common in women during pregnancy or after childbirth. There is also a risk of developing it in the first few weeks after adoption or miscarriage. Psychotic depression. This is a severe form of depression in which a person has psychotic symptoms like hallucinations, delusions, anhedonia, psychomotor retardation, and sleep problems. Signs and symptoms. Depression is more than just being unhappy or fed up for a few days. Most people have downtimes, but when you're depressed, you're down for weeks or months at a time, rather than just a few days. It's a real illness with real symptoms and it's nothing to be ashamed of. Depression affects people in different ways and can cause a wide variety of symptoms. Not everyone who is depressed experiences every symptom. Some people experience only a few symptoms, while others may experience many. The severity and frequency of symptoms will vary depending on the individual and his or her particular illness. Depression can cause lasting feelings of unhappiness and hopelessness, as well as losing interest in the things you used to enjoy. There are physical symptoms too, such as feeling constantly tired, sleeping badly, and having no appetite or sex drive. Most people experience feelings of stress, anxiety, or low mood during difficult times. A low mood may improve after a short period of time, rather than being a sign of depression. At its mildest, you may simply feel persistently low in spirit, while severe depression can make you feel suicidal. Causes of depression. We all experience ups and downs in life, but for people with depression, these feelings are more intense and last for longer periods of time. Depression is one of the most common mental disorders in the United States. Research suggests that genetic, biological, environmental, and psychological factors play a role in triggering depression. There is no single cause of depression, and it can affect people in different ways. But sometimes you can also become depressed for no obvious reason. Some possible causes of depression include genetics. The risk of developing depression is higher if a family member, such as a parent or sibling, has been diagnosed with it. Stress, chronic social stress or stressful life events, like a death in the family, a job loss, or divorce can be a factor in developing depression. Life cycle changes, aging, childbirth, and menopause can also trigger depression in some people. How to deal with depression? There's no single proven way to cure depression, but there are many treatment options to help these symptoms, including medication, therapy, lifestyle changes, and self-help groups. Mental health professional. Because there are many different types of depression, it's important to seek help from a mental health professional if you think you may be experiencing symptoms of depression. Talking therapies, such as cognitive behavioral therapy, CBT, are often used for mild depression that is not improving, or moderate depression. Antidepressants, though not preferred, are also sometimes prescribed. Meditation. According to mental health experts, meditation may ease depression symptoms. Compassion-based meditation helps to focus on your well-being and ease negative feelings associated with depression. Sleep. If you don't get enough sleep, you may be more likely to develop depression. Maintain a regular bedtime and wake-up time. Making sleep a priority can help you feel better, both mentally and physically. Balanced diet. Eating a nutritious diet regularly can help ease depression symptoms and improve your overall mental health. Exercising regularly. Research shows that regular exercise can help ease a number of mental health conditions, including depression. Engage in some physical activity. Just 30 minutes a day of walking can boost your mood. Managing stress. Social stress or stressful life events may trigger depression in some people. Do what you can as you can. Don't feel pressured if you fail or lag. Prioritize your tasks. Decide what must be done and what can wait. Try to connect with others and share your feelings with people you trust. Postpone major decisions, such as marriage or divorce or changing jobs, until you feel better. Take a break from the toxic relationship and focus on your health. Make you a priority. Most importantly, avoid using alcohol, nicotine, or drugs, including unnecessary medications. If you or someone you care about is experiencing signs of depression, we urge you to get help. You may not realize how much they would be suffering. Support them in recovering and moving on from their grief. Don't leave them alone to suffer in silence any longer. Depression is a serious illness, and it's important to seek treatment as soon as possible. Just like with any other illness, there is no shame in seeking mental help. Speak with a doctor right away. With the right help, you can manage your symptoms and feel better. There are many different types of depression, and plenty of treatments are available depending on the type. Depression is a serious illness, however, it is also very treatable. The good news is even the most severe cases of depression can be treated. The earlier treatment begins, the better the outcome. With the right treatment and support, most people with depression can make a full recovery. And yes, there is hope. Share this video with someone you believe needs assistance or should watch it to understand your situation better. Spread the love by hitting the like button. Please remember to subscribe to our channel.